Okay, my friends, today I want to talk about high hemoglobin and increasing the erythrocyte inside of the organism of a human being. So, first of all, we have to think about the risk factors. There is a few risk factors, which is age, genetic, smoking, and environment also is affecting on the person's organism. So in this case, we have to think about oncology also because it is pretty important, and the diagnosis of the oncology primarily is too important. That's why we have to uh, get the case very nicely, and differential diagnosis is also important. That's why we have to also think about the oncology. So the first case, we have to think about the person, which is smoker or not smoker, or aged or not aged, because it is pretty important. In a COPD and heart failure, usually we have this situation increasing the amount of the hemoglobin inside of the blood, and erythrocyte also increasing. So the main causes are decreasing the oxygen inside of the human being. So oxygen capacity is too important. If the body is not able to get enough oxygen, then it requires to increase the blood pressure and also to increase the erythrocyte hemoglobin to get more oxygenation for the organism. So that's why in these cases we are getting more actually erythrocyte and hemoglobin inside of the blood. So what we have to expect first of all. So if the person is aged, we have to listen to her lung and ask about the edema in the legs, because it is the signs of the heart failure. So heart failure is also one of the risks for decreasing the amount of the oxygenation inside of the organism. Why? Because the liquid will accumulate inside of the lung, and there will be defect of the oxygen, deficiency of the oxygen. So that's why we have to think about heart failure first of all inside of someone which is aged, and secondary we have to think about the oncology. So the signs are during the walking, the person feels dyspnea. So dyspnea is one of the signs of the heart failure, which is few meters the person is walking or going up from the stairs and getting tired, and he have to rest or she have to rest, or and heart palpitation will increase when physical activity is present in the person. So for decreasing the risk and alarming of the person during the heart palpitation and increasing of the dyspnea, the heart will warn the person to rest in order to get more oxygenation to prevent the myocardial infarction. So in this situation, the person will have more erythrocyte, maybe thrombocyte, or also increasing, because the damage usually are more inside of the organism, the damage of the cell because of the lack of oxygen. So there's few other causes: dehydration, kidney cancer, liver cancer, and also about an oncology situation, which is erythrocyte products and increasing the amount of the erythrocytes. So it was the last one, but we are looking at it and discussing it primarily and firstly. Polycythemia vera, it's oncology also. So inside of the red bone marrow will get more production of the erythrocyte. So the second is liver cancer. It's a rare case, but it's also causing the increasing of the amount of the erythrocyte, because of the increasing the amount of the hormone which is reproducing from the tumor. So it's the result of the secretion of the erythropoietin by the tumor. And the other one was heart failure, which we discussed about it, which it has three parts: left heart failure, right heart failure, and biventricular heart failure, which they are actually two related together. How the firstly person started with left heart failure, because usually the person which have hypertension during too long time and they are not controlled hypertension, usually it is developing and getting right heart failure also, and it will be both actually. And then the main problems will happen in the pulmonary hypertension also will happen in the person, and the situation will be worsened. So the other one is about the person which is smoking, or few times or multiple times attacks of the asthma will happen during few years, and the person gets a COPD, chronic obstructive pulmonary diseases. This is a hard situation because it's also increasing the risk of the lung cancer. The lung cancer also is too dangerous. That's why smoking is one of the most dangerous ones. Right now I am living in Russia and practicing in Russia. So few years ago, about 10 or 15 years ago, in Russia, first cancer was the stomach cancer. But right now, actually, in the Russia, the two common cases, which they are oncology, it's about the COPD. Usually, right now, it's happening in the young aged people. So it is too dangerous, or I'm recommending you to not smoke, because in the woman, usually the cases which they are coming to us, and primarily we have to diagnose it. They have chronic cough, and when we are doing some examinations, we are finding out the mammary gland or cancer and the lung cancer. I don't know how it's related to each other during the smoking, but usually maybe it is metastasis through the axillary line, but usually it's happening, and it's not a good situation. So there's few videos in the internet which we have to watch the COPD and about the heart failure, but the main thing which we discussed about it, it was about increasing the amount of the erythrocytes, thrombocyte, and hemoglobin. So it's too important. There is heart failure. If the person is young, you have to think about the oncology, and the person have to go to a doctor, which is how to say, the hematologist have to check the case totally, and if he didn't find out anything, the person have to examine it more in order to know what's the cause. So thank you for your attention.